Hello and welcome to our presentation showcasing the work of the Cardiac Electromechanics Research Group, CEMRG, at Imperial College London as a case study for the TEA platform.
Today, we are excited to delve into one of our flagship projects, the CemrgApp, which is revolutionizing the way we analyze cardiovascular data. Jose and I are members of CEMRG at Imperial College. Our research group applies statistical, machine learning, and simulation approaches to study the physiology, pathophysiology, diagnosis, and treatment of the heart. We are an inherently interdisciplinary research group, bringing together mathematicians, engineers, statisticians, experimental researchers, and clinicians. The combination of technical expertise and clinical insight makes CEMRG uniquely positioned to drive translational research and make a real impact in the field of cardiovascular medicine.
Now we turn our attention to the innovative tool that is at the forefront of our efforts, the Scar Quantification tool, or SQT, within the CEMRG platform. Expect to learn the importance of scar identification and how it is performed, the role of the SQT in analyzing scar tissue in the heart and how it works, the fairness assurance analysis made for the SQT, and how fairness claims were chosen and backed.
Scar tissue in the heart can lead to serious complications such as abnormal heart rhythms, making accurate identification paramount for effective diagnosis and treatment. Identifying scar tissue accurately can help clinicians make informed decisions and improve patient outcomes. The only non-invasive tool to assess scar tissue is through an advanced 3D imaging technology known as late gadolinium enhanced cardiac magnetic resonance, or LGE-CMR, to identify scar tissue in the heart, in which scar tissue appears brighter than normal healthy tissue. Manually assessing these scans can vary depending on the operator.
The main focus of this case study is the Scar Quantification tool, or SQT, within the CemrgApp platform. This tool is a crucial component of our efforts to analyze the scar tissue in the heart. It enables us to visualize and validate the steps required for accurate quantification of scar tissue. Now, let's delve into how the SQT works. Taking an LGE CMR scan as input, the tool goes through three main phases. 1. Segmentation to isolate the left atrium within the heart. 2. Generating a 3D representation of its geometry. And then 3. Creating a scar map based on the signal intensity from the LGE scan. The user design presents several push buttons, sequentially numbered to present steps in a workflow, which are then visualized within the same user interface. In the video, we can see the later stages of the process, where a 3D model is created with different colors to indicate the amount of scar tissue per region.
Fairness assurance is crucial for ensuring that the SQT operates ethically and accurately. In this case study, we have considered factors such as bias mitigation, diversity, and inclusivity. CMRGApp in general is tailored to patient-specific workflows where the physiological data corresponds to an individual. While this brings many opportunities for personalized healthcare, it also carries risks. Most notably, the possible risk of unequal performance for individuals or subgroups of the population. Therefore, it is worth considering how such risks can be identified, evaluated, and mitigated.
Alongside the Turing team, we approached the development of an insurance case for the SQT using the following general approach. First, we explored a general understanding of a concept of fairness. Then we considered different examples of practical fairness issues that are present and used core attributes of fairness as strategies for identifying exemplary claims and evidence for a draft assurance case. This became an introspection exercise of our software, which provided us with a snapshot of our project with regards to fairness, its strengths, shortcomings, and possibilities for future developments.
We settled on the following core attributes and their impact in the project: bias mitigation across the project lifecycle, diversity and inclusivity for project governance, non-discrimination in model outcomes, and equitable impact of the system.
Our bias mitigation claim is that the SQT reduces undesirable operator variability to limit the impact of cognitive biases when using the image processing pipeline and chosen thresholds. Standardizing analysis methods and providing specific thresholds backed by the relevant literature are essential steps in ensuring that clinical decisions are driven by objective data rather than individual interpretations.
It's essential for the SQT to engage patients and healthcare professionals from all backgrounds. The tool promotes patient engagement and interactive decision making through accessible visualizations, making healthcare more inclusive for everyone. Our claim about this is that the tool supports patient engagement and interactive decision making through accessible and informative visualizations, and that the user interface and dashboard are intuitive and follow the best practices for presentation of information.
Regards with equitable impact, the tool is open source and easily accessible to allow clinicians to run the software. And the tool is efficient in terms of computational resources, allowing for widespread use. Ensuring equitable impact is another key goal of the SQT. By being open source and efficient in terms of resources, the tool can reach more healthcare providers and ultimately benefit more patients.
Non-discrimination is paramount in the development of the SQT. With deep learning techniques and careful validation, we are working to minimize biases and ensure fairness in the analysis process. For this, our claim is that the tool does not discriminate across different patient groups and ensures quality and consistency of results across users with different level of training.
Finally, let's address the challenges and limitations we face in ensuring fairness assurance for the SQT. While we've made significant progress, there are still hurdles to overcome, such as user engagement and validation across different demographics. But rest assured, we're committed to continuous improvement and ensuring that the SQT operates ethically and fairly for all patients. As we conclude today's presentation, it is crucial to recognize that advancement in tools like the Scar Quantification tool are pivotal for improving patient outcomes and ensuring fairness and equity in healthcare.
Indeed, by prioritizing accuracy, inclusivity, and fairness in our analysis processes, we are not only advancing cardiovascular medicine, but also fostering a more equitable future in healthcare. Thank you for listening.